Welcome to the training presentation on Aquasil Ultra Plus and the Digit Power Dispenser. Aquasil Ultra Plus is a high-precision dental impression material that comprises the full range of viscosities and delivery options to enable all kinds of impression techniques. The Digit Power Dispenser allows precise and ergonomic delivery of Aquasil Ultra Plus wash materials. This training presentation will help you to understand the basic concepts of indirect restorations and impression taking. You will also learn about the features and benefits of Aquasil Ultra Plus and the Digit Power Dispenser and how to sell them effectively. This training presentation is split in two sections. Firstly, you will hear why dentists take impressions at all. You will learn about indirect restorations, about key requirements towards impression materials, different impression-taking techniques, and how these techniques impact the choice of the right Aquasil Ultra Plus viscosities. You can skip this section of the presentation if you already feel comfortable with the basic concepts of impression taking. Secondly, the features and benefits of Aquasil Ultra Plus and the Digit Power Dispenser will be introduced. You will learn about how to probe around related customer needs. We will begin with some basic aspects on the subject of impression materials. What are precision impression materials used for? What are the key requirements of impression materials, and how are they applied? How are viscosities and impression-taking techniques connected? These and other fundamental questions should be answered in the following. Highly precise impression materials like Aquasil Ultra Plus are used to produce so-called indirect restorations. But what is an indirect restoration? Indirect restoration of a tooth is necessary if its crown is so severely destroyed, for example due to caries, that the defect can no longer be treated with a filling fabricated directly in the oral cavity by the dentist. Instead, the artificial restoration, custom fabricated outside the oral cavity, is cemented onto the tooth. For a long time, restorations fabricated using precious metal, such as gold crown, were the standard restoration in such cases. Nowadays, patients increasingly request white restorations because of their much improved aesthetic properties. This can be achieved by fitting ceramic restorations. If you would like to learn more about the subject of permanent cementation of restorations and the assigned products Calibra and Prime and Bond, we recommend viewing the Calibra training presentation. In this picture, you can see some examples of indirect all-ceramic single-tooth restorations. Left an inlay, center an anterior crown, right a posterior crown. Not only the crowns of single teeth have to be restored. Impressions are also necessary in cases where teeth are missing and must be replaced completely, for example, with fixed partial dentures or even implants. Here you can see three examples. Left, a fixed partial denture framework fabricated using zirconia, which still has to be veneered with porcelain. Center shows a porcelain fused to metal fixed partial denture, consisting of a metal alloy and a porcelain veneer. On the right is an implant abutment with a crown still to be cemented on the abutment. During fabrication of all these restorations, the impression serves as a link and instrument for information transfer between dentist and dental technician. So why do dentists need impression materials at all? And when exactly are they used in the treatment procedure? An impression essentially is a negative replica of a patient's teeth and soft tissues. As already mentioned, it is used to pass dental information on to a dental lab to produce fixed or removable partial dentures. Impressions are taken with the aid of so-called impression trays. An impression tray is used as a carrier for the actual impression material. The impression tray is loaded with the impression material and inserted in the oral cavity. With precision impressions, additional impression material is also directly applied to the structures that will be incorporated in the impression, as we will see later. Prefabricated metal impression trays are commercially available from Dentsply Sirona under the brand name of Rimlock. So-called triple trays are also used, which are particularly popular in the USA. Let's use a clinical example to take a look at how impressions integrate into the fabrication process of restorations. Firstly, the dentist prepares the abutment teeth. That is the teeth that are intended to support the fixed partial denture. To pass this information on to the dental lab, the dentist now takes an impression of the prepared teeth and oral mucosa surrounding the teeth. After taking the impression, the tray and impression material are removed together from the oral cavity, disinfected, and sent to the dental technician. Flowable dental stone is now poured into the impression in the lab. After the dental stone has set, the restoration is fabricated on the resulting model by the dental technician. The dentist finally cements the restoration on the prepared teeth. This video will examine tooth preparation and final impression taking. In this case, an all-ceramic crown is planned. The tooth is prepared from all sides to allow sufficient layer thickness of the restoration. An ideal preparation requires at least 3 to 4 mm of residual height and a taper of around 10 degrees to create inherent retention. After preparation, the tooth and the surrounding anatomy are ready for the final impression. Aquasil Ultra Plus is syringed around the prepared tooth. Syringing continues at the axial walls and onto the occlusal surface. Remember to keep the tip in the material at all times to prevent voids or bubbles in the final impression. The remaining washed material is placed across the adjacent occlusal surface. The tray is then seated and stabilized in the mouth. After set, the impression can be removed. To see that all detail has been recorded, that no errors have occurred, and that no voids, tears, or bubbles are detected. The impression can now be sent to the dental lab for final crown fabrication. You have now learned about examples for indirect restoration and have an idea why impressions are required for fabricating them. But which individual properties must a modern impression material have to meet the requirements of dentists? A modern impression material, as used for fabrication of indirect restorations, must be able to reproduce structures to be included in the impression with the highest possible precision. A precise impression and an equally precise dental lab model, fabricated on the basis of the impression, are the prerequisite for creating an accurately fitting restoration. Even minor inaccuracies can result in inaccurate fits. For example, crown margins which are too short or long, inadequate hygiene capability, secondary caries, gingivitis, or incorrect occlusal height, to name just a few complications. In the worst-case scenario, the restoration cannot be fitted intraorally at all and must be remade after taking a new impression, which costs the dentist and the lab a lot of additional time and expenses. A precise dental lab model is based on 3 essential properties of the impression material. Firstly, its tear or tensile strength, meaning its ability to withstand growth of cuts under tension. Secondly, its hydrophilicity. Hydrophilicity is a measure of an impression material's ability to maintain contact with moist surfaces. Thirdly, its dimensional stability, which is the ability of the impression to maintain its original dimensions while being used for the intended purpose. Firstly, we would like to focus on the tear strength. Why is tear strength such an important property of an impression material? To comprehend the importance of tear strength, you must understand the term preparation margin and also know a little about the anatomical structure directly adjacent to the teeth, the gums, also referred to as gingiva. When fabricating fixed restorations, the dentist trims the abutment teeth of the patient, as already mentioned. This is also known as the so-called preparation. The most important part of this preparation is the so-called preparation margin. This is the area where the prepared tooth surface merges with the unprepared, still naturally healthy crown or root surfaces. An impression material must be capable of completely flowing round the preparation margin so that the margins of the indirect restoration produced by the dental technician fit accurately on the preparation margin. This is the most important factor for the long-term success of indirect restorations. It is easy to take an impression if the preparation margin is located above the gingiva, that is supragingival, as shown on the photograph by the broken line. But what happens if this is not the case? Often, preparation margins are positioned below the gingival margin. For example, in the region between the adjacent teeth, the interproximal area. Or because the tooth to be restored has been destroyed by caries too deep below the gingiva. Or also with anterior teeth, with which the dentist often intentionally positions the preparation margin subgingivally to mask interfering crown margins, which are frequently problematic for the aesthetics, particularly with porcelain fused to metal restorations. In such cases, the term used is subgingival preparation. Dentists use a special technique to take an impression of the preparation margin subgingivally. They place retraction cords in the fine gap between gingiva and preparation margin, the so-called gingival sulcus, to widen it temporarily and thus facilitate access to the preparation margin for the impression material. Here you can see photographs to illustrate this technique. On the left photograph, a cord is held in position using a probe placed in the subgingival sulcus of a molar using a special instrument. In the center, you can see a cord placed on a premolar. Placed retraction cords are left in position for a few minutes and only removed again immediately before taking the impression. Often retraction cords are soaked with a hemostatic substance, for example, ferrous sulfate, to prevent gingival bleeding when removing the cords. This also makes it easier to take the impression. In this photograph, you can see a dental lab model, which was fabricated on the basis of a successful impression. The gingival sulci are opened wide, and the preparation margins are clearly visible. With an impression of such high quality, the preparation margin can be quickly and precisely exposed by the dental technician using a rotary instrument. The conditions for fabricating an accurately fitting restoration are ideal. Now, what does all this have to do with tear strength? After removing the retraction cords, the dentist begins taking the impression. The impression material is applied, this means syringed around the tooth to be included in the impression, and into the gingival sulcus. Unfortunately, the widened sulcus has a tendency to close again quickly after removing the cords. In addition, the impression material requires a few minutes until it is set and can be removed again from the patient's mouth. As a result, the impression material is thinned out to a fine flash in the sulcus. If an impression material is used that only has low tear resistance, this fine flash can tear off when the impression is removed from the oral cavity, as happened in the photograph on the left. If this occurs, the most important information of the impression, namely the contour of the preparation margin, is lost for the dental technician. On the right-hand photograph, you can see an example of a failed impression. Determination of the preparation margin would be a guess for the dental technician. In contrast, this is how a perfect impression looks, taken using Aquasil Ultra Plus and Digit Power Dispenser. The molar was prepared for fitting a crown. Can you see the preparation margin? The broken line shows the margin. The arrows indicate the Aquasil Ultra Plus flash areas, which extend deep into the gingival sulcus and remain completely intact, even when the impression is removed. They enclose the preparation margin all the way around, enabling the preparation margin to be clearly visible. The second important requirement of a precision impression material is that its hydrophilicity should be as pronounced as possible. What does this involve? Firstly, let's more precisely define the two terms hydrophilicity and contact angle, which are associated with one another. As already mentioned briefly at the beginning of this presentation, hydrophilicity is a measure of the ability to maintain contact with moist surfaces, which makes it a very relevant property for any impression material. The hydrophilicity of an impression material is determined by the contact angle, which the edges of a water drop form on the surface of the material. If the angle is relatively small, it is referred to as a hydrophilic material, as seen on the center photograph. Materials with a wide contact angle are referred to as hydrophobic. Here, some examples of hydrophilic and hydrophobic surfaces in nature and industry. Bird feathers have pronounced water-repellent properties, that is, hydrophobic properties, to keep the animals dry, even in wet environs. Water drops form a large contact angle on a bird's feathers. Similar behavior is also observed on outdoor clothing, which is also designed to be water-repellent. Contact lenses, in contrast, must have pronounced hydrophilicity, as they are placed on the moist cornea of the human eye. Hydrophilic materials are often particularly used in medical applications, as the human body primarily consists of water. Dental impression materials are no exception in this context, as the prepared tooth surface is usually covered with a film of moisture. This is due on the one hand to the generally moist milieu of the oral cavity, and, on the other hand, to the properties of the tooth surface itself. Dentin is permeated by microscopic channels, so-called dentinal tubules. Body liquid exudes from the dentinal tubules with freshly prepared vital teeth, moistening the prepared dentin surface. Impression materials must, therefore, be capable of wetting the moist dentin surfaces completely in an accurate detail. They must be hydrophilic. Last but not least, let us look briefly into the topic of dimensional stability. An impression that is used for the fabrication of a restoration must be completely dimensionally stable. This means that the impression must not deform even after days or weeks. In this picture, you can see an impression taken using a material that already deforms visibly after a short time. It is a so-called alginate. Alginate impressions consist of a powder that is mixed with water into a gel-like paste. Alginates are easy to use and great materials for fabricating study models and provisionals. Unfortunately, they are also highly prone to drying out. After only a few hours of dry storage, they begin to deform considerably, as can be seen in this photographic sequence. They are therefore unsuitable for use when fabricating restoration. The two key chemistries that state-of-the-art impression materials are built upon are polyethers and acetylsilicones. Both share important advantages. They are both dimensionally stable and have excellent detail reproduction. They are both very established in the marketplace. Improgum from 3M is a polyether. Aquasil Ultra Plus is an acetylsilicone. The A stands for addition. The term addition describes a special curing mechanism in which no volatile byproducts are created. This makes acetylsilicones very dimensionally stable impression materials. In contrast, C-silicones produce alcohols during setting. The alcohol evaporates, thus causing the impression to shrink, similar to alginates. In addition to the versions presented here, further impression materials such as hydrocolloids and vinyl polyether silicones are available, yet of little significance in the marketplace. Aquasil Ultra Plus is, as are impression materials produced by other manufacturers, available in a variety of viscosities which are mainly used in specific combination. The various viscosities allow dentists to employ different impression techniques. A basic understanding of the various impression techniques is required to be able to recommend the combination of viscosities to suit techniques preferred by customers. First, what exactly is viscosity? Viscosity is a measure of a fluid's flowability. The higher a fluid's viscosity, the less flowable it is. The lower a fluid's viscosity, the faster it flows. This animation illustrates this concept. The fluid on the left has a lower viscosity and thus flows faster than the fluid on the right. In practice, the impression procedure is divided into the two following steps, for which different viscosities are usually used. To collect all the important details of the preparation, a low viscosity material is used for the preparation tooth. These are also often referred to as wash materials or light bodies. The low viscosity impression material is applied by the dentist. In contrast, for loading the impression tray, a higher viscosity material is used, which serves as a carrier material for the low viscosity component. The higher viscosity prevents the material flowing out of the impression tray, and when placing the tray on the dental arc, enables hydraulic pressure to be exerted on the low viscosity material, thus adapting it more effectively to the prepared tooth. The tray is usually loaded by the dental assistant. Finally, we would like to deal with the meanings of the terms intraoral work time and set time. Modern impression materials are paste-paste systems. They consist of two components, the base paste and the catalyst paste. Both components must be mixed together to initiate curing of the impression material. Aquasil Ultra Plus also functions according to this principle. The product is always available in an appropriate two-chamber system, regardless of which viscosity or delivery form. Some examples are illustrated in this photograph. The 50 milliliter cartridge and the digit serve as examples for Aquasil Ultra Plus's two-chamber delivery. As soon as both components are mixed together, the impression material begins to cure slowly. During curing, the viscosity of the material increases until the impression is finally so firm that it can be removed again from the patient's mouth. The blue line in the diagram illustrates this curing over time. Two aspects are worth noting during impression taking. The material must remain moldable until syringing around the abutment teeth using a light body material and subsequent intraoral placement of the tray are complete. The viscosity may therefore only increase slightly in this phase of the procedure. On the other hand, once the tray is finally placed, the impression material should always reach its final hardness as soon as possible, so that the waiting time until removal of the impression is as short as possible. Time is money. In conclusion, both intraoral working time and set time, hence mouth removal time, should be as long as necessary and as short as possible. We'll see later how Aquasil Ultra Plus meets these requirements. You now have acquired a great deal of knowledge about impression materials in general. You already know that tear strength, hydrophilicity, and dimensional accuracy are essential requirements of precision impression materials. Let's now discuss how Aquasil Ultra Plus particularly meets these and other requirements, and how you can find out whether the resulting clinical benefits are of interest for your customers. Aquasil Ultra Plus is a further enhanced version of the proven Aquasil Ultra impression material. Countless dental professionals have been using this product successfully for many years and confirm the outstanding properties of this material. The improvements carried out around Aquasil Ultra Plus have now made the material even better. The most important improvement of the new generation Aquasil Ultra Plus was achieved in terms of the hydrophilicity of the product. Due to a blend of surfactants that has been added to the two recommended low-viscosity materials, XLV and LV, Aquasil Ultra Plus now has much improved hydrophilicity. The test methods were performed on uncured material at 80% relative humidity similar to conditions in the oral cavity. Aquasil Ultra Plus achieves leading intraoral hydrophilicity without compromising tear strength. Beyond that, monophase was renamed to medium to align with viscosity names. The same standardized TL mixing tip is now included for all viscosities. The mouth removal time for fast set was shortened by 30 seconds. The work and set times of the putties were adjusted. The shade of the Deca putty used to be yellow and has been changed to blue. The new Digit Power cartridges are not cross-compatible with the conventional Digit cartridges. Important features that did not change are the viscosities, clinical indications, the product's mint taste, and its price positioning. Taking a high-grade impression is no trivial matter. A study on impression quality carried out by the dental faculties of Harvard University, Boston, and the Hadassah Hebrew University, Jerusalem, Israel, came to the conclusion that 89% of all impressions examined included one or more errors. The most frequent or problematic impression errors involve the occurrence of voids or tears at the preparation margin. This study showed that half of all impressions are affected by these problems. Dental technicians directly affected by this problem confirm these findings. A survey indicated that almost half the labs polled indicated that inferior quality impressions is the greatest challenge faced by laboratories. This is a problem for dental technicians. They are not in a position to simply reject their clients' impressions. Clinicians are aware of the challenges of their current systems and want more clinically relevant options. 86% of clinicians want a material that works better in the presence of moisture, making the most sought-after product improvement. 74% of clinicians want a material that is better suited for all cases they see in their office, not just the ideal ones. 92% agree precision delivery is critical to their final impression success. 69% return at least one crown per month to the lab for remaking. 69% of clinicians retake at least one impression per month. And 44% are concerned about soft tissue management in context with impression taking. Let us now see how Aquasil Ultra Plus and the Digit Dispenser can help to solving these challenges. One of the most important properties of our product, Aquasil Ultra Plus, is its excellent tear strength, both during removal from the patient's mouth and after full curing 24 hours later. This prevents flash being torn off the impression, and the impression is more precise in the region of the preparation margin. The following illustrates several tests which demonstrate the tear strength of Aquasil Ultra Plus. Oblong specimens of Aquasil Ultra Plus and competitors' products were fabricated for performing the tests. A notch was inserted in all specimens to produce a so-called break-off point. The diameter of the specimens in the notch region was only 265 micrometers. This approximately corresponds to the diameter of impression flash in the gingival sulcus. The two ends of a specimen are stretched in a material testing machine. The machine then begins to apply controlled traction to one of the two ends. As impression materials are elastic, this elongates the specimen. At the same time, the force exerted on the break-off point continuously increases until the specimen tears at this point. The computer determines the maximum force required for this, which corresponds to the tear strength of the material. Please note, in our tests, the notched specimens are torn at mouth removal time plus 90 seconds, which is the fastest measure that has ever been done. Competitors measure tear strength in thick pieces many minutes after material sets. Since impression material gets stronger over time, this creates a false measurement for clinicians who want performance at mouth removal time and not 15 minutes later. Let us first look at how the Dentsply Sirona product Aquasil Ultra Plus behaves. The testing machine pulls the ends of the Aquasil specimen apart, and the force exerted on the specimen, shown as a red line in the diagram, increases continuously. The specimen tears at a force of approximately 23 Newton, and the force exerted drops back to the value 0. How does this tear strength compare with key competitors' products? We will first look at the product Imprint 4 from 3M SB. Imprint 4, like Aquasil Ultra Plus, is an A-silicone, which is generally regarded as containing impression materials with comparatively high tear strength. However, Imprint 4 already tears at 19 Newton, meaning 17% less force exertion than required with Aquasil Ultra Plus. By far the most important competitor, however, is the 3M SB product Imprigum, a product from the polyether impression material group. Pay close attention because the show is over quickly. The Imprigum specimen already tears at approximately 7.5 Newton, which is only 1/3 of the force required for Aquasil Ultra Plus. Polyether impression materials are known for their relatively low tear strength. We now look at another minor variation of the test. Instead of subjecting the specimens to continually increasing force, a fixed force should now be exerted and the time measured after which the specimen tears. Again, we'll begin with Aquasil Ultra Plus. The testing machine moves the force to be exerted on the sample up to 1.6 kilograms and remains in that position. After how long does the material tear? While the Aquasil Ultra Plus specimen is in the process of not tearing, we want to use the time to take a look at our competitors. Firstly, Imprigum, the polyether. The specimen already tears after just 3 seconds at 1.6 kilograms fixed loading. The A-silicone V-Possil, President from Coltane Whale-Dent, Take 1A from Care, and FlexTime from Kulzer each tear after approximately 5 to 6 seconds. Imprint 4 from 3M SB takes approximately 10 seconds. In contrast, we are still waiting for the Aquasil Ultra Plus specimen to fail. The internal Dispenser test results were confirmed by the research group led by Dr. Alan Bogosian from the Feinberg School of Medicine in Chicago, USA. The group compared the tear strength of various low-viscosity, fast-set impression materials at 120 thickness using a standard tensile method. Conclusion: Aquasil Ultra Plus was significantly stronger than the other impression materials tested at both the manufacturer's recommended mouth removal time and after 24 hours of setting. Dispenser's QM resin technology provides for the superior tear strength of Aquasil Ultra Plus. Compared to regular VPS resin, which is bifunctional, QM resin is a quadrifunctional, short-chain vinyl polysiloxane. Because of this quadruple functionality, the cross-linking density of the polymer is much higher than the traditional asilicone impression materials, even though they share the same polymerization mechanism. It could also be said that, thanks to the QM resin, Aquasil Ultra Plus forms a network with more junction points than regular asilicone impression materials, and therefore possesses increased tear strength. Imagine 2 fishing nets, one with 4 junction points per mesh and one with only 3 junction points. Which net will tear sooner when loaded? Surely the one with fewer junction points. Please watch the following promotional video illustrating Aquasil's tear strength.
Tears and voids at the margin are the most common errors in impression taking. Aquasil Ultra Plus impression material is designed to reduce the risk of tears when removing from the mouth, even in those tricky, thin cross-sections. How? Better chemistry. Impression materials that rely on polyether, C-silicone, and traditional A-silicone technologies rely on linear bonds. While these bifunctional bonds deliver different levels of tear strength, they are all vulnerable by nature. Our patented chemistry affords chemical connections to occur through polyfunctional bonds, or branching. There are simply more points of connection. This creates less room for tear vulnerabilities and less room for a compromised impression. Aquasil Ultra Plus impression material has unique, high intraoral tear strength to accommodate a wider set of cases, including where less retraction occurs, like with paste or other retraction methods, to help ensure material is removed from the sulcus intact. Our tear strength improves over the first 24 hours of set time, providing even higher tear strength for the lab. This helps ensure multiple pours if necessary. You don't have to choose between wettability, tear strength, speed, and delivery options. Experience the next evolution of impression material. Introducing Aquasil Ultra Plus.
One final observation on the subject of tear strength. In the dental lab, impressions are often poured not just once, but several times. One reason for this is that during fabrication of the indirect restorations, the dental stone model is abraded slightly. A crown that fits on the stone model does not necessarily also fit intraorally. To ensure a perfect fit, a second model is therefore often fabricated on which the fit is double-checked. And of course, the impression should not tear when a second, third, or even fourth model are poured. Let's see how we can probe for less tearing and thus higher accuracy. Here is a sample sales call as an example of how that could work. Doctor, when you are taking an impression for the indirect restoration, which part of the impression matters most and why?
It's the prep margin for sure. Marginal fit is critical for restoration success. Poor marginal fit can cause all kinds of issues, secondary caries, etc.
What happens if the prep margin is not sufficiently captured, for instance, due to tearing of the impression material? What consequences will that have?
It means the restoration is likely to fit badly. In the worst case, both impression and restoration have to be remade.
I see. Would you be interested learning more about an impression material that has outstanding tear resistance and thus high accuracy? As well as tear strength, hydrophilicity is also an essential feature of an impression material. It contributes decisively to the ability of the impression material to reproduce the details of oral structures accurately. Impressions with only slightly pronounced hydrophilicity tend only to wet moist surfaces incompletely. Incomplete wetting can, however, result in inclusion of undesired air bubbles in the impression, as can be seen in the photo on the right. As already mentioned, in order to fabricate precisely fitting prosthetic restorations, dental technicians depend on dentists producing impressions which are as precise as possible. The more air bubbles an impression has, the more information about the condition of the prepared tooth is lost, and the more inaccurate the model fabricated from the impression. Air bubbles in the region of the preparation margin are particularly annoying. We will now take a look at how the hydrophilic properties of Aquasil Ultra Plus compare with those of key competitor products. For this purpose, we drizzled the surface of different impressions with 1 drop of water each. To reproduce clinical conditions as closely as possible and thus ensure that the test was clinically relevant, the water drops were applied to freshly dispensed, uncured impression material at a relative humidity of 80%. On the Aquasil Ultra Plus XLV surface, the water drops spread rapidly and the contact angle was just 15 degrees, 2 seconds after application. Improgum and Imprint 3 surfaces were much less hydrophilic. The contact angle measured 49 respectively, 70 degrees. With 19 degrees, Imprint 4 achieved a more favorable result, but is also inferior to Aquasil Ultra Plus. This illustration summarizes the measured contact angle clearly in a single graphic representation. Among all impression materials tested, Aquasil Ultra Plus has the smallest contact angle. A promotional video is also available showing this property.
"86% of clinicians want a material with a better contact angle, making this the highest sought-after product improvement feature. Why? because a moisture-tolerant material is a key contributor to successful detail capture. Hydrophilicity or contact angle is most important to clinicians when the material is being dispensed intraorally while the material is uncured. A drop of water is placed on samples of both Aquasil Ultra Plus impression material and competitor's material to test the contact angle. Our material gets to work right away in moist, humid environments, addressing the risks of impression errors due to voids at the margin from the get-go. In fact, Aquasil Ultra Plus impression material has the lowest contact angle on the market for both cured and uncured material. There is no better impression material for intraoral hydrophilicity. You don't have to choose between wettability, tear strength, speed, and delivery options. Experience the next evolution of impression material. Introducing Aquasil Ultra Plus.
If you want to find out whether your customer could be interested in a particularly hydrophilic impression material, the following interview scenario will give you some suggestions. Doctor, how important is it to avoid the formation of bubbles and voids when taking a precision impression?
Very important. That's why it's called a precision impression. It must reproduce all details precisely.
Are there areas in which bubble formation is particularly problematic?
Yes, the preparation margins, the critical area of any impression.
What happens if bubbles occur in the region of preparation margins?
In the worst-case scenario, the impression must be retaken.
I see. Would an impression material that swiftly spreads on moist, hard, and soft tissues help to avoid the formation of bubbles and voids? Another benefit of Aquasil Ultra Plus is its comprehensive range of viscosities and delivery systems, which enable all possible impression-taking techniques. Irrespective of which technique your customer prefers, Aquasil Ultra Plus provides the ideal solution. Which viscosities are used is determined by the impression technique in use and the personal preference of the dentist. The following Dentsply Sirona Aquasil Ultra Plus flowable viscosities are available for syringing around the prepared tooth: extra low, low, and medium. On the other hand, the firmer viscosities, putty, heavy, and medium, are available for loading the impression tray. Please note, putty is available as a hard putty and a soft putty version, which differ in both viscosity and final hardness. You can see that medium has a special status among the viscosities. Its flowability is between low and high, and it is the only viscosity that can be used both for syringing around the prepared tooth and loading the impression tray. Medium is recommended as the go-to material for simpler cases where the monophase technique works particularly well. For more challenging cases, XLV or LV are recommended. In order to understand which viscosities are required for which technique, let's take a look at the various impression techniques. The so-called putty wash technique involves taking the impression in two steps. First, a preliminary impression is taken using putty only. In principle, this preliminary impression acts as a highly precise impression tray for the specific patient. Once the impression has cured and been removed from the patient's mouth, the area around the preparation margins is trimmed off and escape channels cut to create space for the wash or light body material applied in step 2. The second impression is then taken using the preliminary impression as a tray. Depending on the preference of the dentist, LV or XLV is syringed around the preparation. At the same time, the wash material is loaded into the special tray fabricated previously. Following this, the tray is repositioned in the patient's mouth. Once the material has cured, the impression is finished and can be removed from the mouth. The so-called dual-phase or sandwich impression technique involves taking the impression in a single stage. The tray is loaded with high viscosity, typically heavy, and XLV or LV syringed around the teeth and preparation margins. Following this, the tray is placed in the patient's mouth and the material allowed to cure before removing it from the mouth. This concludes impression taking. Unlike the techniques mentioned previously, The monophase technique involves using material of the same viscosity for syringing around the teeth and preparation margins, and loading the tray. The tray is placed in the patient's mouth and the material allowed to cure before removing it again. As when taking dual-phase impressions, this is a one-step technique. Aquasil Ultra Plus is also available in a range of delivery systems from right to left. In the conventional cans, contents 450 milliliter. As Deca cartridge with 380 milliliter content, for use in the Duo Mix 2 mixer. As 50 milliliter cartridge for use in combination with the conventional Automix gun. And as a Digit cartridge, the Digit is for single unit dosage. Which viscosities are available in which delivery systems? The putty viscosity is available from the can and in the Deca cartridge for the Duo Mix 2 mixer. The heavy and medium versions are both also available in the Deca cartridge, as well as in the 50 milliliter cartridge for the Automix gun. The XLV and LV light bodies are also available in the 50 milliliter and in the Digit cartridge. Digits can be applied using the so-called Digit Dispenser, a simple syringe-type device similar to the Automix gun, or using the new Digit Power Dispenser, an electrically operated yet cordless handpiece for automatic, precise application of Aquasil Ultra Plus. This chart provides an overview of all three impression techniques together with the corresponding viscosities and available forms of delivery. The monophase technique requires the use of medium viscosity material only, which is supplied in a 50 milliliter cartridge and Deca delivery. In principle, every viscosity may be used for the dual-phase technique. The tray is usually loaded with heavy or soft putty from a cartridge, Deca, or tub, and intraoral application carried out with XLV or LV from a Digit or 50 milliliter cartridge. Medium may also be used. The putty wash technique is carried out with XLV or LV and soft putty or hard putty. The various viscosities are available in regular set and fast set versions. XLV and heavy are also available as extended set versions, which are particularly indicated for implant impressions, where more time is required. We'll take a closer look at the different setting times later. As already mentioned briefly, the new Digit Power Dispenser is available immediately for applying Aquasil Ultra Plus from the Digit, a world debut in dental impression materials. The Digit Power Dispenser combines a number of unique handling advantages. Compared to the Automix gun, the mixing tip is almost 2/3 closer to the tooth. Deflection of the tip when dispensing due to wrist movement is also greatly reduced. The amount of force required for applying impression material with the Digit Power Dispenser is 80% less than with the Automix gun, and its weight is reduced by 40%. All these properties result in considerably more precise and simplified application of the light body using the Digit Power Dispenser. Please note the following short video. The enhanced working ergonomics provided by the Digit Power Dispenser are just as important as simplicity of delivery. Dental professionals spend their entire lives working in awkward, straining postures, which manifest to musculoskeletal disorders in the long term. Musculoskeletal disorders are injuries or pain in the human musculoskeletal system, including the joints, ligaments, muscles, nerves, tendons, and structures that support limbs, back, and neck. They result from carrying out the same stressful movements again and again. Working ergonomics are an important aspect of dentists' activities. The oral cavity can only be accessed from one specific direction, and as the view of the teeth is frequently restricted, certain regions can only be viewed with a mirror. During their working lives, dentists spend about 60,000 hours in postures injurious in the long term. Up to 93% of them suffer musculoskeletal disorders, whereas 70 to 90% suffer recurring pain. Musculoskeletal disorders are the most common reason for members of the dental profession ceasing practicing dentistry prematurely. Well-thought-out delivery systems for medical products can play an important role in improving working ergonomics for dentists. Good working ergonomics for dentists are characterized by working with a straight, upright back. This rules out long-term injury to the musculoskeletal system. The Digit Power Dispenser is designed for applying Aquasil Ultra Plus optimally and takes clinicians' ergonomic requirements into account ideally. This device dramatically reduces the distance between the dentist's hand and the preparation, can be operated with only one hand, and syringes around the preparation at the press of a button. And all of this with only minimal weight and without a cord. Help your clients improve their working posture during impression taking by demonstrating the Digit Power Dispenser to them. Here again, the direct comparison between Digit Power Dispenser left and Automix gun right. The distance between the guiding hand and the dispensing tip reduces from 20 to 7.6 centimeters. The Digit Power Dispenser weighs only 176 grams compared to the 306-gram heavy Automix gun. The impression material is then dispensed very easily at the press of a button. Now please take a look at the following short video showing the enhanced working ergonomics made possible by the Digit Power Dispenser. The Digit Power Dispenser is equipped with a slim mixing tip. Digit cartridges are inserted simply by removing the cap. Dispensing at the press of a button in fast or slow speed, or using the foot control, also progressively. The version used is selected using the power button. Display provides information about the status of the working and setting times using a countdown timer. Clinicians with previous experience in using the Digit Power Dispenser consistently rated the device positively. On a scale of 0 to 5, where 5 is the top rating, the Power Dispenser was awarded an average of between 4 and 5 for each criterion. It could hardly do better than that. This assessment was confirmed during discussions with our clients. For example, they emphasized the easy, accurate delivery, ensuring less voids. Thanks to its cordless design, the Power Dispenser is mobile and can be used in different treatment rooms. Wastage of valuable material in mixing tips is always a topic with our clients, not only involving impression materials. When using a conventional mixing tip, such as that used with the Aquasil Ultra Plus 50 ml cartridge, approximately 2 milliliters of material are discarded. The much smaller mixing tip of the Digit Power Dispenser only wastes 0.25 of a milliliter, almost 90% less. Let's find out whether your customer is tired of working with dispensing systems with poor handling qualities. There's a range of issues relating to problems which can be made the subject of a discussion in a sales talk. For example, improving working ergonomics, automatic mixing and application of the material at the press of a button, or the low weight. The following scenario is intended to deal with accurate application. Doctor, how far is your hand from the structure you are taking an impression of when using your current dispensing system?
Using the auto-mix gun, I would estimate about 8 inches.
Is this not a considerable distance? How difficult is it to apply accurately, for example, along a preparation margin?
It is not always very easy.
What is the reason?
The reason is that even comparatively small hand movements translate into relatively large movements of the dispensing tips.
I know what you mean. Would an application system that allows better control of movements bring clinical benefits for you? The Digit Power Dispenser is supplied in 3 attractive colors: white, orange, and mint. Regardless of the color, each Power Dispenser kit comprises 1 handpiece and 1 charging base, 50 disposable barriers, power cord with power blades, and 3 cartridge caps. How should the Digit Power Dispenser be cleaned? By wipe disinfection. First, dismantle and clean the cartridge cap. Then thoroughly wipe all device surfaces with a single-use cloth in combination with a locally approved bactericidal, tuberculocidal, virucidal, fungicidal disinfectant. Use the disinfectant according to the manufacturer's instructions for use. Please note that the disinfection recommendations may vary per market. Finally, let's consider the regular set, fast set, and extended set versions of Aquasil Ultra Plus and their advantages for various clinical situations. Aquasil Ultra Plus is an extremely flexible material with regard to working and setting times. Dental practitioners are confronted with very different clinical demands every day. Sometimes only a few teeth must be treated, sometimes many at the same time. This also impacts the impression. It is clear that single-tooth impressions are much less time-consuming than impressions of many prepared teeth. For this reason, Aquasil Ultra Plus is available in different intraoral working times, setting times, and, as a consequence of both, in various so-called mouth removal times. Mouth removal time is the time at which the impression is sufficiently set that it can be removed at the earliest from the mouth, without having to worry about permanent deformation. More precisely, Aquasil Ultra Plus viscosities XLV, LV, medium, and heavy are available in the following setting versions. In the regular set version, dentists have 1 minute and 10 seconds available for syringing around the prepared teeth. With the flowable viscosities LV or XLV, this is the latest moment at which the tray loaded with the carrier material must be placed in the patient's mouth. The setting time is 3 minutes and 50 seconds. This means that 5 minutes after beginning the procedure, the impression can be removed from the patient. The fast set option can be used for taking impressions of only a few teeth. In this case, 35 seconds are available for applying the light body, and curing then takes 1 minute and 55 seconds. After a total of 2 minutes and 30 seconds, the impression can be removed. The extended set version is intended for implant impressions. At 1 minute and 45 seconds, this provides the longest intraoral working time. The setting time is 3 minutes and 45 seconds. The impression can be removed after 5 minutes and 30 seconds. Please note that the intraoral work and set times apply at certain ambient temperatures. The times for XLV, LV, medium, and heavy viscosities were measured at body temperature. As higher temperatures accelerate chemical reactions, the higher the ambient temperature is, the shorter the working and setting times will be. The hard putty and soft putty materials used for the putty wash technique exhibit their own work, set, and mouth removal times. Both hard and soft putties are available as a regular set version with an intraoral working time of 2 minutes and a set time of 3 minutes. This means the preliminary impression can be removed from the patient's mouth 5 minutes after beginning mixing the components. Soft putty is also available in a fast set version with working and setting times of 1 minute 30 seconds and a corresponding mouth removal time of 3 minutes. The intraoral working time of putty was determined at room temperature, as this material is mixed and loaded into the tray outside of the oral cavity. The setting times for XLV, LV, and medium, shown previously, apply to the so-called wash impression. Please keep in mind that the work, set, and mouth removal times of the new Aquasil Ultra Plus putties that you have just seen have changed somewhat compared to the old versions. The new Aquasil Ultra Plus regular set soft putty available in Deca delivery has a longer work time of 2 minutes versus 1 minute 30 seconds with the old version. As mentioned earlier already, the shade of the old Aquasil Deca putty used to be yellow and now has been changed to blue. The Aquasil Ultra Plus Fast Set Soft Putty in cans offers an accelerated set time of 1 minute and 30 seconds. The Aquasil Ultra Plus Regular Set Hard Putty in cans offers both a longer working and set time of 2 and 3 minutes, respectively. The shades of both canned putties have not changed. Please don't forget our competitor, Impergum, is strongly represented, particularly in the area of implant impressions. Make your customers aware of the fact that Aquasil Ultra Plus is also ideally suited for this indication. Its tear strength and dimensional accuracy provide the optimum conditions. The combination of Aquasil Ultra Plus Heavy and XLV is particularly recommended for implant impressions. As mentioned, the fast, regular, and extended set versions provide dentists with a wide range of flexibility adapted to the respective clinical situation. As we are on the subject of Impergum, here 2 last tips. In addition to the comparatively moderate tear strength and hydrophilicity, polyether materials like Impergum leave a terrible taste in the mouth and are therefore very unpopular with patients. Aquasil Ultra Plus, in contrast, leaves a fresh mint taste, making the visit to the dentist a slightly more pleasant experience. Polyethers can also sometimes only be removed from the patient's mouth with great difficulty due to their high final hardness and sticky surface, particularly in cases with residual dentition. Ask any Impergum users among your customers whether they have made this type of experience. Our product's rigidity is high, yet easy to remove, especially compared to Impergum. Let us summarize what you have learned. Our product offers highest tear strength and hydrophilicity, both intraorally and when cured, leading to less tears and voids, hence higher impression accuracy. Aquasil Ultra Plus comprises the full range of viscosities and delivery options to enable all kinds of impression techniques. The Digit Power Dispenser allows precise and controlled intraoral access of Aquasil Ultra Plus wash materials. Last but not least, the range of intraoral working and mouth removal times serve all clinical situations, single as well as multiple unit and implant impressions. We would like to remind you that the full sales and marketing collateral on Aquasil Ultra Plus and the Digit Power Dispenser, including this training presentation, is available on the Dentsply Sirona Sales Compass. Please ask your manager how to get access to the Dentsply Sirona Sales Compass if you don't already have it. This is the end of the training presentation. Thank you for being so attentive. Dentsply Sirona Restorative would like to wish you all the best when selling Aquasil Ultra Plus and the Digit Power Dispenser.